Most people don't think about the role that identity plays in healthcare, but it's essential.
How would you explain exactly what Vouched does?
So anybody who's going to interact with the healthcare system, that interaction actually starts with identity.
What makes ID verification uniquely challenging?
In order to discuss a person's healthcare records with them, you need to be fairly convinced they are who they say they are.
How does your system ensure that identity checks stay on the right side of patients' privacy laws?
We all come from regulatory backgrounds, we all come from compliance backgrounds, and
Do you think that we're doing a better job of looking at potential issues?
most people want to trust people who show up. These tools are very powerful, and there's something we all have to think about.
Hello and welcome to Healthcare Journeys. I am your host, Kevin Rosenquist. Thanks for joining us today. In a healthcare system increasingly reliant on digital access, identity verification is no longer a nice to have, it's essential. From telehealth visits to online prescription refills, knowing who's on the other side of the screen is a matter of safety, compliance, and trust. My guest today is Peter Horadan, CEO of Vouched, a company using AI and computer vision to automate identity verification for industries where accuracy matters, like healthcare. So, Peter, welcome. It's great to have you here.
Thank you, Kevin. Thanks for having me.
Absolutely. So let's start at the ground level. For someone who doesn't work in tech or healthcare compliance, how would you explain exactly what Vouched does and why it matters for healthcare access?
Well, we do remote ID verification. So anybody who's going to interact with the healthcare system, that interaction actually starts with identity. We're all used to filling out those forms in the doctor's office and writing your name on 7 times on 7 different forms and your address over and over again. If you're remote, what does that look like? How do you prove your identity for healthcare? And so Vouched has a process for that, where you can prove your identity online, and you have actually more certainty that the person is who they say they are online than you have in a physical context.
Okay. And from HIPAA regulations to insurance eligibility, there's obviously a lot on the line here. So what makes ID verification uniquely challenging in this space, maybe compared to banking or e-commerce?
Yeah, it's interesting. I mean, most people don't think about the role that identity plays in healthcare, but it's essential. You cannot deliver healthcare without identity. And there's a couple of reasons for that. You mentioned a few of them. One is HIPAA compliance. So if you go to see a doctor and the doctor starts talking to you about your medical background and you're not actually the person, you're not actually who you say you are, that doctor is breaking HIPAA. And this happens. This might seem like an unlikely scenario, but people do, for whatever reason, impersonate somebody else to try to get access to their healthcare records. This could happen in messy divorces or lots of other contexts.
Wow.
So the first step in treating a patient is knowing who the patient is. And in order to discuss a person's healthcare records with them, you need to be fairly convinced they are who they say they are. Then there's insurance, which you mentioned. It's common that a person who does not have insurance would try to impersonate a person who does have insurance in order to use that insurance. And so if you don't have a defense against that, not only you're participating in insurance fraud, which is not something that anybody wants to do. And then another reason is prescribing medication. So once it comes time to prescribe medication to the patient, the DEA requires that there's a bona fide doctor-patient relationship in place. And again, that starts with identity. If you're prescribing medicine to a person with a fraudulent identity, that's very bad. And you'll have a DEA issue, you'll have a state licensure issue, and so on. So for all of those reasons, HIPAA, insurance, and the DEA regulations and your state licensure regulations, treating a patient or doing anything in healthcare with a patient starts with knowing the identity of that patient.
Does this stuff happen often?
It happens often enough. And
Yeah.
if you are not doing a good enough job at verifying identity, you will be in regulatory trouble when these things come up. If you, let's say that you get caught up in an insurance fraud situation where patients have been coming into your practice committing insurance fraud, and the regulator takes a look and says, tell me what defenses you have against insurance fraud. Tell me how you're verifying identity. And if you say something like, oh, well, I have people send me a photocopy of their driver's license. Well, that's a profoundly naive way to do identity. And I would say you would be at risk where the regulator would say that's not good enough. Yeah. And you might be in some trouble with that regulator. For about $2 these days, you can get a very good fake photocopied driver's license. You simply upload the address you want, the picture you want, you pick a state, you pick a driver's license type, you want the commercial driver's license or the regular one or the underage one? Each state has a couple different templates. You choose what you want. You upload your stuff, $2. You get back an image of a photocopy of a driver's license. It looks really real, and we'll fool naive systems. And so we actually, we work in the financial space a lot, and regulators like FINRA have actually started to sue banks who don't do enough to help their customers prevent identity fraud. So the bank, if there's identity fraud, is on the hook not only for the fraud in the first place, but then the regulators are suing them for damages for not doing enough to help their customers prevent identity fraud. And you just do not want to be in that position if you start to encounter issues where you're having identity issues with the patients who you thought you were treating.
Mm-hmm.
Yeah.
I just recently added, because I have like a Google Pay wallet, and I just recently added my driver's license to it because I'm in Colorado and I'm allowed to do that.
Yes.
And there's other stuff you can do. You can put your insurance cards in there. You can put a lot of documents, a lot of important documents into that wallet. Is that the future?
Yeah, it is. And this is, when people think of identity, we often think of just showing this driver's license that you carry around in your wallet or purse. And that's how I grew up. But that's actually changing. There's several changes coming to the world of identity that I think most people aren't aware of. And so, Kevin, you're an early adopter.
Yeah, all right, ahead of the curve.
Fortunately, your state is, but mobile driver's licenses are coming. So mobile driver's license is when the state issues, rather than issue you this card that you carry around, they issue you a digital first document that then lives on your phone, like you were just describing. And so 10 states have a pilot program for this already. About 1 million people have been issued a mobile driver's license, and you're starting to see it be accepted. For example, when you go to the airport, you'll see a sign that says mobile identities are accepted here.
Yeah.
And so that changes identity in some really interesting ways. Today, if you want to know who's on the other end of a online interaction, you have to ask that person to show their identity card to the camera. And so what you do is you hold that identity card, your driver's license, your passport, or whatever it is, up to the camera. We take an image of it. We ask you to turn it around. We take an image of the back. And then we can get into this. There's all kinds of checks we do to make sure that hasn't been tampered with and that fraud isn't occurring here. But when you have a mobile first document, you simply then go in and say, go grab it out of you mentioned a Google Wallet, or Apple has a similar program. Go grab it out of my Google Wallet, attach it, and then send that digital document along. It's a lot easier. It's digital first. It's signed by the state, the issuing authority, so you can't tamper with it. The information has been signed and cannot be modified. And so it changes how identity is going to work. Soon, I think it's going to become much more commonplace that online people will be asking for you to provide your driver's license to prove your identity, because it's just simply going to become a lot easier.
Yeah, and it was interesting. It was, I had to do the picture on my phone, and then the Google sent it to the state of Colorado, and they had to verify it. Yeah. And then it came back and they gave me the thumbs up, so it took like 2 minutes. Right. But it's interesting, because you are still getting it verified by the state. It's not just like you're popping it on there and being like, hey, this is my ID, because you could definitely have fraud in that scenario. But I'm interested to see how that all plays out, just because of the fact that people at least in this country don't use it very much. So if you go to a bar and they ask for an ID and you show your phone, they're going to be like, am I allowed to accept this? I don't think people know yet,
Yeah, we're still in the early days where, not even all states support this yet. But by next year, the estimate is at least 30 states will have pilot programs, and about 50 million people will have been issued a mobile by the end of 2026. And then by the end of 2027, it'll be almost everyone will at least have the ability to have a mobile driver's license. There's, a national standard for how do you access these, how do you look at this document. And you're right, you mentioned you do have to verify your face with Google before you can add it to your wallet. But then we still need ways to prove that no one's stolen your phone. As an example, that that there are ways to steal the mobile driver's license file. And if you've somehow gotten access to that file, how do we prove that you're still you, as opposed to an imposter who's gotten the mobile driver's license file and is using that to try to impersonate you?
Yeah. There's always going to be those kind of checks and balances that have to happen in order to keep the bad guys at bay as much as possible. Now, for Vouched, you guys, you use AI for it's AI powered verification, correct?
Absolutely.
All right. So can you kind of walk us through how that works and the idea of balancing automation with accuracy?
Yeah. So These days AI is stamped on everything. Vouch has been doing this for the better part of 7 years now, where we were one of the innovators actually in using AI modeling to detect identity fraud. So here's the way the system works. And by the way, AI is not only used by us to make identity to do a much better job of verifying identity, but AI is used by fraudsters to make it much harder to prove
Absolutely.
identity. So we should dive into that a bit. But here's how the process works. So let's say that you're in a scenario where you need to prove your identity in a convincing way. That might be opening a bank account remotely. It might be healthcare, like we're talking about today. It could be a rental. You're renting someone's apartment or their car, and they want to know who you are before giving you this asset. So the way it works today is you show your driver's license to the camera, like I just talked about. You hold it up, take a picture of both sides. This takes about 8 seconds on average or less. Most people complete this very quickly. We then go do a bunch of checks. Number one, to make sure that that document hasn't been tampered with. We have over 4,000 ID templates at Vouched of all the different ID types around the world, every passport, every Visa card, every driver's license style. Every state has variations of their driver's license. You could have the one that doesn't let you drive, but still an ID card. There's an underage one, and so on. So we have templates of what this should look like. We know the exact placement, the exact typeface that's used. We know, is the picture rounded or not? What security features are on there? We verify all of those things to ensure that the ID hasn't been tampered with. Then we go do remote data verification. So the person often in a sign-up process is asked to enter their email address, their phone number, other things about themselves, maybe their tax ID. And then we go verify all of that. Does all of this data hang together? Has anything been modified, or has this person entered any data that doesn't match what we already know about the person? And then third is we make sure that the person in front of the camera matches the person on the ID. So there's a liveness check to make sure that this is a real person, that you're actually here and moving, that you're not replaying some old video, like holding an iPad up to the camera and playing a video you took of the person previously, that you're not just holding a picture of their face over
Right.
your face or wearing a
Right.
mask. We have AI detection algorithms for all of that. We make sure that the person is alive and real and present in real time. And then we make sure that the face that is in the camera matches the face on the ID. So with all three legs of that stool, it's a very robust program for ensuring people are who they say they are. And then the other thing we do at Vouched is we focus a lot on conversion and making it really easy, because it's one thing when you're opening a bank account, you are expecting to really have to prove your identity in a strong way, or if you're making a wire transfer, you have an expectation that it's the burden is on you to prove who you are before you enter this financial transaction.
Sure.
In healthcare, patients don't have that same expectation. They just want to get their medical needs met. They want to see the healthcare provider. They want to purchase a medical product. They're not used to this idea that I'm going to have to prove strong identity before I do this. And so for healthcare, we have done a lot of work to make conversion as easy as possible. So as I mentioned, most patients get through the process in 8 seconds or less, and we try to make it as painless as possible for them, while still meeting all of those regulatory requirements that we talked about at the beginning.
That's always a good balance, right? The friction versus the compliance. Yeah, it's always a struggle.
Yeah, that's literally the trade-off. But we've obsessed about this, and from our earliest days. So we are the leader in healthcare. We have more healthcare clients than anyone else in the space, and we've been doing it. Our very first days, we were healthcare first, and so that led us. We have a different DNA in a way, where one of the things that matters the most to us is completion, because we want the patients to get on with this process as quickly as possible.
Mm-hmm.
Yeah,
that's really cool. And you mentioned data. Obviously, there's lots of data involved in this. That's it's important to have that legally protected. How does your system ensure that identity checks stay on the right side of patients' privacy laws?
So we're, again, that's, as I mentioned, this is cooked into the DNA of the company. We all come from regulatory backgrounds. We all come from compliance backgrounds, and that is just built into everything that we do. Before we build anything, before we ship it, we think about what regulations do we need to comply with, what security do we need to comply with, and we ship it. A lot of the answer to your question comes down to building a company with the right culture that knows that we don't do anything before we've thought about how do we do privacy, how do we do safety, and how do we comply with regulation.
Yeah, you kind of have to, right? I mean, for what you guys do,
Yeah.
if you don't take that approach, you're in trouble.
That's right.
Somehow. Can you give us a real world example of how a healthcare organization uses Vouched?
Yeah. So, for example, and we have case studies on our website. People are welcome to look, but it's very interesting. We're still replacing paper. I've had probably a 20-year career of replacing paper in various different industries. Before this, I worked in the sales tax space. I worked in the expense reporting space. We would go through and replace paper-based systems with automated systems. And I joined Vouch because I became excited that, to me, identity is the next frontier, where identity is still managed very manually. Even today, even in 2025, it's very common to hear, "Oh, just send me a photocopy of your driver's license, and we'll take that." That is a very naive way. If identity matters at all to you, it's a very naive way to do it. It only costs, as I mentioned earlier, about $2 to get a very convincing fake photocopy of a driver's license with whatever data you want. If you want the real physical ID, that costs about $50. So you just go to you go to a website, you enter the address information, the driver's license number you want, you choose a state, you upload a photo, you pay your $50, you wait about 2 weeks, and you will get a box of socks in the mail. And inside one of those socks is your absolutely perfect ID. It has the reflective features. It has the UV light, the barcode on the back scans. It's unbelievable how easy this is, actually, and it costs very little. And so it's very easy to defeat manual systems. And the other thing about manual systems is that they're very costly. So if you have a person who's looking at this photocopied ID and trying to figure out, is this a good ID or a bad ID? Number one, they don't really have the tooling or the training to do that well. But it's also taking up their time, and especially if they go into databases to try to verify any information. Estimates are it costs about $30 to $50 of staff time. The thing that we don't think about these healthcare forms that we all hate filling out, not only do we hate filling out all those forms before you see the doctor, the staff hates them too. They have to read these forms and go hand enter all that information.
And try to decipher my horrible handwriting.
That's right. Doesn't love it either. And when you have a manual process that's online, you're just replicating the same thing. Someone on your staff has to read the email or whatever, however you're onboarding this information, and go enter that into your EHR system. So what this client did is they had a system where they wanted, send me a photocopy. They had a couple of identity issues. The staff hated it. They wanted it to be completely automated. And this customer was selling medical devices. And so we implemented Vouched for them. And they love it because, number one, there's no staff data entry. We read the entry off the ID for you. We read the entry off the health insurance card. We hand that to you. So you don't have to re-enter any of that. It's all done electronically. Staff doesn't have to spend any time thinking about that. And as your patients grow, as your practice grows, you can accept more patients without any more staff time, because once you've implemented it, it's 100% automated. And not only that, but we're actually already implemented, depending on what your platform is, what your core systems are. We've already integrated with most healthcare systems already. So you usually can just go turn it on.
That's really cool.
Yeah.
Plug and play is everybody's favorite for sure.
Right.
You mentioned before about the fraudsters getting more creative using AI and all that. What's on your radar as far as the next big challenge out there for healthcare providers, just for identity in general? And where do you think it's going to go? I mean, we talked a little bit about the digital ID, but what do you put on your Nostradamus cap? Where are we heading?
Yeah. So identity is going to be changing in some pretty big ways. And I think most businesses aren't aware yet of the choices that they're going to have to make to figure out, well, how do I deal with these new realities that are emerging? One is mobile driver's licenses, which we already talked about. Most people don't know that you're in a very small club of having already used this. But it's going to be coming. And within the next 2 years, most people will become aware of mobile driver's licenses and start to have experience with them. The next change that's coming to identity is software agents. We're starting to hear more and more about software agents. What these are AI like ChatGPT that do some task on your behalf. And so they take some burden or chore off of your plate. And that could happen whether you're a business and you might have a AI agent that's going to implement some workflow for you, maybe some part of your purchasing system or some other business process that you have, but also for consumers. And an example that gets used a lot is like an AI travel agent. Mm-hmm. So you may have a software travel agent that you can just say, hey, listen, I'm really tired. I need a vacation this weekend. So I want to be in Hawaii. So find me a hotel, find me a beach, and find me a plane ticket. And other than that, I don't want to think about it. I'm looking forward to this vacation. This software agent will then go off. It knows your preferences. It'll go scour the sites, deal sites, what's available, what's not, everything else, and come back to you and say, okay, I've planned your vacation. you could get on this flight. I could get you an aisle seat that I know you like. I could get you, here's a hotel room with a nice view, and here's the beach. And, would you like me to book this for you? You say, yes, that sounds terrific. And then the agent goes off and books it. That's a common example we hear a lot.
Yeah. I remember hearing that in the early days of, early days for the regular consumer when ChatGPT came out as being a huge use case for it.
That's right. That's right. And, healthcare, this is going to happen too. You might think in healthcare, oh, well, I don't have to think about this. But this reality is going to be knocking on your door pretty quickly. Like a common healthcare use case would be a software agent that says, Peter is low on his essential medications. Could you please renew his prescription? And he's going to pick it up at CVS tomorrow morning. Well, okay, what do? I've got an AI software agent showing up claiming to represent Peter, and seems convincing. It has some information about me. It has my login and username and password maybe. But has Peter really authorized this agent to do this? If you even acknowledge the existence of the prescription to the software agent, and the software agent is not working on behalf of me, that's a HIPAA violation, and that's a state licensure violation. So you can get into a lot of trouble really quickly if some agent shows up. And this agent might email your front desk and say, hey, please do this. I'm a software agent working for Peter. Please do this renewal. This is going to happen sooner than you think. The prediction is that by as early as next year, 2026, that there will be more non-human actors on the internet. In other words, AI agents doing stuff, than there will be human actors. And we're starting to see agents be released very quickly. Anthropic put out this specification called MCP, which is a behind-the-scenes specification of how do agents talk to web systems in order to do things such as buy a plane ticket or renew a prescription or see a list of flights. And that has taken off, and people are running with implementing that. And there's already, we were just recently reviewing a list. There's already over 4,000 software agents that have already been released using the specification. And it's a good thing. I mean, they're profoundly useful. I would love to have a software agent booking a vacation for me.
That sounds great.
So here's the problem. So now let's think about this from, I'm a healthcare provider. I'm providing a service remotely on the internet. What problems am I going to have thinking about these software agents should show up? The first is telling good agents from bad agents. So if you think about email was created 50 years ago, and there are a lot of bad email senders these days, spammers. But when email was created 50 years ago, nobody thought about that in advance. It was an altruistic time, and people just thought, well, people will just use this for good. And there's no built-in systems in the email ecosystem to tell good senders from bad senders. And so 50 years later, we're still dealing with spam. And, sometimes
tons of it. Yeah.
Yeah. How many times have you heard, oh, I sent you the code, but go look in your spam folder. Maybe it went to spam. Or, we all have to buy these tools, these anti-spam tools. And you have this like bloated folder kind of in your inbox that you rarely look at. But sometimes important stuff goes in there.
Sometimes it does.
There's like 1,000, gross things in there. So we're not able to tell good senders apart from bad senders. And we still have this real spam issue today, 50 years later. We can't make the same mistake with agents. We're going to have a way to tell good software agents apart from bad software agents. We know there will be malicious ones. There'll probably be way more malicious ones than there are good agents. And so how do you tell them apart? We're going to have an agent identity system, number one, so that agents can have an identity and that identity cannot be spoofed. And then number two, we're going to have an agent reputation system where if I allow an agent to work with me and I know that agent's identity, and then that agent behaves badly somehow, I can report that and I can influence the reputation of this agent. So you think of this in marketplace seller systems. So any system where you have a marketplace and sellers and all those sellers have a reputation, that's kind of a model for, I think, what needs to evolve with agents. And that's not in place yet. The industry still needs to invent that. So that's problem number one. How do I tell good agents from bad agents?
Yeah.
Problem number two, how do I track which humans have given which powers to which agents to do which things? So this question of, has Peter really authorized this agent to see his medical records and to renew his prescriptions? And this becomes a problem because you're going to have to figure out how to track this. Now, the MCP spec, this how agents talk to servers spec that I talked about, it addresses this, but only in the very briefest way. It effectively says there will be this OAuth, this technical standard session, and whatever the session is, the agent will have those permissions. Well, how did that get established in the first place? Did the human being share their username and password with the agent? that will never work because you're never going to be able to keep these agents up to date as your passwords change. It's a big
Right.
security risk to give your plain text password to an agent that you maybe don't know very
Absolutely.
well. This is completely unwieldy and will never work. So we need to invent a way that humans can delegate authority to agents, and then that authority needs to be fine-grained. For example, in our travel booking, you might want to allow the agent to book a plane ticket and use your miles, but not book a plane ticket using cash. Let's just say, for whatever reason, or you might want to allow the agent to see your flights, but not cancel a flight.
Right.
As an example.
Okay.
So how do you track in a fine-grained way what humans have given what agents what permissions? We've got to come up with that. And again, for people listening to your podcast who might be hearing about this for the very first time, you might think, well, this isn't going to affect me. Actually, it is sooner than you think. Within a couple of
It can affect
years,
everybody.
that's right.
Yeah.
Every business is going to have to think about this. That there will be software agents showing up, wanting to do stuff on behalf of humans. You can ignore the first few, but soon it's going to become a major issue for you as all of these agents show up at your front door, and your patients, your customers, want to use these things. And so, how are you going to support that? Okay, the next issue with agents is legal agreements. So let's go back to booking that plane ticket. So we've all had that experience of buying a plane ticket. At the very bottom is the checkbox that says, I agree to the terms and conditions, the contract of carriage for the plane ticket.
Mhm. That we all read fully.
That's right. That's right. Just do an experiment. Try buying a plane ticket without checking that little box. You can't. There's no way you can do it. It simply won't let you. You can't say, I want this ticket, but I don't agree to this, but give me the ticket anyway. You can't do it.
Right.
Well, why is that? Well, that contract of carriage, it limits the airline's liability in the case of a plane crash or losing your luggage or anything like that. So they're not going to sell you the ticket without it. But an agent cannot agree to that contract of carriage on your behalf. An agent's not a person. An agent doesn't have a power of attorney from you. So, and these little click wrap, these little check boxes, like I agree to terms and conditions, they exist all over the place. How many times have we clicked that thing? And to your point, not even read it, but they're everywhere.
Yeah,
So
like every app you download, normally you have to click something, right?
Right,
Yeah.
right. So if agents start to do work for you on your behalf, how are they going to click those little check boxes when the agent there's no legally binding, there's no legal agreement that's created with an agent clicks a checkbox. The agent is not you, doesn't have the power to click the checkbox for you. And then these OTPs that you get, when you sign into a service and there's like, oh, we sent a 6-digit thing to your cell phone. Well, how are we going to do that? Like if the agent keeps encountering these checks and you get these 6-digit things on your cell phone, you got to say, oh, well, what agent's doing this now? Like I have 10 agents. Which one asked for this stupid thing? And I got to go give the OTP to the agent. And I was asleep, by the way. It's working in the middle of the night while I'm asleep,
Right.
but now I have to give it. Anyway, there's all of these things that need to be reinvented as this agentic future comes out. And, we've done a lot of thinking about that at Vouched, and we've released our proposed framework for how to answer these questions. It's called MCPI or MCP Identity. You can see it on our website. If you just go to vouched.id, there's an AI agents tab. You click on that, and we have a whole system for how to solve these problems. But and the industry is still coming to a consensus on how's this all going to work. And but this is going to be very important because AIs are going to have an identity. They're going to show up and want to do business with you. You've got to answer all those problems I talked about before: good agents for bad agents, human delegation to agents, and legal agreements. And those problems have to be solved. So every business is when you asked me what is coming and what do we need to be thinking about as Nostradamus, it's inevitable that two things are going to happen that are going to change identity. Number one, mobile driver's licenses, and number two, AI agents sitting between you and your human patients or customers.
Wow. And do you think that's so interesting? Do you think that we're doing a better job of looking at the potential issues? Like you made the comment about email, not thinking about spam. Oh, everyone's good. We'll do that. Are we in a better place technology wise, or as people build products with AI and all this, are they thinking about this stuff?
I have optimism. I think
Good.
that we are.
Good.
But AI is getting it's a more potent foe every day on the bad AI side of things. There's news story after news story of the parents sitting at home. Their child is at college. They get a desperate phone call from that child. They're in some kind of crisis. They need money right now. The parents, being good parents, send the money immediately, only to find out that their child is warm and happy in their dorm room, and they've been the victim of a deep fake scam.
Yep.
And what happened is some fraudster went onto social media, found this child, downloaded a bunch of videos of how they talk, how they look, what their mannerisms are, got a bunch of personal information, maybe background information for a convincing story, like where they go to college or what their interests are or whatever it is. They use that to then create a very convincing deepfake where they can in real time type text. It comes out in the voice and mannerisms of the person they're impersonating, the child in this case. And it's been good enough to fool the actual parents of the child into transferring money. Just to do a simple Google search for this, and you'll get hundreds of
so many times I've heard this story.
Right. Yeah. And so that's a very real problem. If a parent can't tell their child that this AI has become very powerful, and actually some of the like Google just released tools at Google I/O earlier this week where you can now make a video with both video and audio, and it's not for the use for bad, but it just shows how far the tools are coming.
Oh yeah,
in terms of being able to impersonate people. You know, and another funny sort of anecdote is this past Christmas or holiday season in the British government. Somebody put out a deep fake video of the leaders of the British government all playing Minecraft on a Minecraft server. So it had Rishi Sunak and Boris Johnson and others all like playing Minecraft together. They had the gamer headset on. They were very engaged. They were in Parliament in Minecraft and doing things. And they each had their own accents, their own mannerisms. They were making jokes that were sort of relevant to their own personal point of view, you know, wherever they came from. And this convinced so many people. So many people were outraged. What are our political leaders doing playing Minecraft? That the campaigns actually issued statements that said, this is not our candidate. This is a deep fake. We have nothing to do with this. You know, this we completely disown everything about what you saw in this video. This is a deep fake. And so these tools are getting more powerful all the time. And most people, you know, we all tend to assume the good in everybody. Most people want to trust people who show up. And these tools are very powerful, and there's something we all have to think about of how do I make sure that if I'm verifying identity, which again is essential to healthcare, how do I ensure that I'm not going to get scammed by, number one, my belief in the good of people and my belief that this can never happen to me, and then the incredible growing power of this AI tooling. And by the way, I should mention too, we've talked a lot about patients, but you have to think about your employees as well.
Yeah,
there are plenty of cases where at maybe larger healthcare providers where someone will create a fake identity, they'll get a job, a clerical working job at a healthcare provider. They'll then go into the electronic healthcare record system. They will download, steal a ton of people's medical records. It only takes one day to go do that, and then they disappear into the night. And you actually have no idea who it was who was doing that because the identity they provided you was completely fraudulent. And so again, if you're just if on the employee onboarding side, if you're just saying send me a photocopy of your remote workers, and you're saying just send me a photocopy of your license or a photocopy of your passport or whatever it is. That can be so easily faked. You're very vulnerable if that's what you're doing.
Yeah, good point. Good point. Wow, interesting stuff for sure. I was going to say before, we've come a long way since the Pope in a designer jacket, right? You remember that picture that came out early in the early days of Dolly? Like we've gotten a lot different, and yeah, the deep fakes are certainly scary. And I've heard those stories because any parent is gonna send that money. So hopefully we can figure that out. Okay, well. Thank you very much for joining us today on Healthcare Journeys. Thank you very much, Peter. It was really nice talking to you. The company is Vouched, vouched.id. Check them out. Lots of stuff on their website. Thank you so much for being here. Really enjoyed the conversation.
Thank you.